The key features of OCD or obsessive compulsive disorder are obsessions and compulsions. Let's see the detailed symptoms of OCD. The next list provides examples of common obsessions but doesn't cover the wide range of thoughts that OCD can include. Obsessions can be about anything. If you can think it, OCD can obsess about it. Fear of contamination by germs, dirt, or other diseases, for example, by touching an elevator button, or shaking someone's hand. Fear of saliva, feces, semen, or vaginal fluids. Doubting, fear of not doing something right which could cause harm to oneself or another, for example, turning off the stove, locking the door. Fear of having done something that could result in harm, such as hitting someone with a car, bumping someone on the subway. Fear of making a mistake, for example, in an email, or when paying a bill. Ordering, fear of negative consequences if things are not just right, in the correct order or exact, for example, shoes must be placed by the bed symmetrically and face north. Religious thoughts, fear of having thoughts that go against one's religion. Preoccupation with religious images and thoughts. Aggressive thoughts, fear of harming others, for example, harming a baby, stabbing someone with a kitchen knife, hurting someone's feelings. Fear of harming self, such as jumping off a bridge, or handling sharp objects. Fear of blurting out obscenities in public, for example, saying something sacrilegious in church. Sexual thoughts, unwanted or forbidden sexual thoughts, images, or urges, for example, the urge to touch a parent in a sexually inappropriate way. Sexual thoughts involving children or incest. Common compulsions, the action or state of forcing or being forced to do something, constraint. An irresistible urge to behave in a certain way. Let's see the common compulsion symptoms. Cleaning or washing, washing hands too frequently or in a ritualized way, ritualized or excessive showering, bathing, grooming routines, cleaning of household items or other objects. Although not a specific ritual, avoidance of objects or situations that are considered contaminated may be a major problem. For example, will not shake hands with others or touch elevator buttons. Checking that nothing terrible did or will happen, such as checking driving routes to make sure you didn't hit anyone with your car. Checking that you don't make mistakes, for example, rereading everything you have written, or asking others whether you said the wrong thing. Ordering or arranging, ensuring that things are just right or consistent with a specific rule. For example, everything in the kitchen must be perfectly lined up, can only wear certain colored clothes on certain days. Mental rituals, needing to count to certain numbers, think certain good or neutral thoughts in response to bad thoughts, or pray repeatedly. Hoarding, it indicates collecting useless items such as newspapers, magazines, bottles, or pieces of garbage. Difficulty parting with unnecessary or excessive belongings, for example, items that may have been useful once, or have sentimental value even though they are not needed, or are simply excessive, such as 30 black sweaters. Inability to throw these items away. Although hoarding used to be considered a feature of OCD, it is now thought of as a separate but related condition. Proper treatment for both obsession and compulsion symptoms can reduce anxiety and sadness. And OCD treatment includes psychiatric medicine and psychotherapy.
Thanks for watching. Please subscribe.